morning, ladies and gentlemen, dear colleagues. My name is Dr. Tashnikov Vadim. I'm a neurologist and pain physician. I worked something about 20 years in Shiba Medical Center, and now I'm in chief of pain unit in Asut Ashdod Clinic, University Clinic. So these are my disclosures, and we're going. I'm going to talk about neuromodulation today. So at the beginning, we have to define the neuromodulation. Neuromodulation is defined as an alteration of nerve activity through the targeted delivery of a stimulus, such as electrical stimulation or chemical agents, to a specific neurological site in the body. So, what are we going to talk about today? We're going to talk about the evolution of this kind of treatment, the evolution in different ways, the evolution of our understandings of the mechanism, the evolution of techniques, the evolution of hardware, software, the evolution of targets of stimulation, and the evolution of clinical approaches, indications, and contraindications. So we begin with understanding of the mechanism. Historically, we know the neuromodulation from the ancient Greece, when Galen tried to treat the headaches and neuropathic pain of Marcus Aurelius with torpedo fish. But the current history of neuromodulation starting in 60s, in 1960s, when the gate theory of Patrick Wall and Robert Melzack was published. So the main idea of the gate theory is that there are two different nerve systems, the large fiber system and the small fiber system, which are concurrent. They bring the information to the interneuron in the spine, and when we increase the information stream in the small fiber system, we can increase the stimulation of the interneuron, and we can increase the pain sensation of the patient. On the other hand, when we increase the information stream in the large fiber system, we can close the gate and decrease the pain sensation. So it was an idea to introduce principally new kind of treatment, spinal cord stimulation. We try to stimulate posterior columns, to stimulate the large fiber system, to close the gate of the pain. But now we know very well that gate theory has a relatively small value in this treatment, and there are a lot of different other mechanisms we can mention here. Antidromic activation of segmental inhibitory circuit, or orthodromic activation of that circuit in the brainstem, resulting with descending inhibition. So every neuromodulator system we know in the spine could be involved in this treatment, in the mechanism of this treatment, with increasing of GABAergic activity, with decrease of glutamatergic activity, with the increase of descending serotoninergic inhibition, and all others neuromodulatory system. So implantation techniques. The first device was implanted by American neurosurgeon Dr. Shelley in 1967. It was implanted by open surgery, subdural electrode, and the stimulator. It was a very simple two-contact electrode, and it was infected during 3 days after the implantation, and the device was took out. It was a patient with oncologic disease and severe neuropathic pain. So, but the point is that during these 3 days, then the device was in, it showed very good and very impressive improvement in the pain of the patient. So during 50 years from the beginning of the implantation, the techniques were changed, and now we put the electrode in epidural space. We do it percutaneously without cut the tissue. To put the electrode, we cut the tissue to put the IPG, but for the electrode, we don't need to make any cutting. We put the electrode in the epidural space, make a navigation to the area we need, make the stimulation to verify the position, and we can put the electrode there for long time and to help our patients. We know very well, we have maps where to put the electrode now for the cervical pain, for the shoulder pain, for the arm pain, for upper back pain, lower back pain, buttock pain, legs pain, and pelvic floor pain. So it's very well documented, and we know where to put the electrode now.
Sorry to interrupt, but could you move your presentation around? Just want to see if it works or if it's stuck.
Okay, and now?
Yes.
What is it now? Wonderful. So I'll show it in this way, not okay. So during last 50 years, the techniques were changed, and now we can put the electrode by the retrograde way, by the caudal way from the to the epidural space, and transforaminal. So let's see the evolution of the devices, the evolution of the hardware. The first electrode introduced to the market was 4-contact lead, and after it, during some years, many other electrodes were introduced to the market. Electrodes with 8 contacts, electrodes with 16 contacts, and the surgical electrodes with 32 and 50 contacts. So it is a very important thing, because when we put 2 or 3 electrodes, we can change the electrical field that we apply on the posterior columns. We can make vertical electric field, a horizontal electric field, or even oblique electric field oriented to one side or another side with different cathode and anode. And so it makes the stimulation much more better and much more precise to the patient. Modern aid, the surgical lead, wide surgical lead that we can put that consists of 32 or 50 contacts, we can make absolutely different electric fields on this electrode with different shape and different orientation of the electrical field, and make the stimulation very, 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 very complicated and very precise and very specific for the patient. The next step of the developing in neuromodulation was creating of MRI compatible devices. The point is that the MRI machine includes some different coils inside. One of them is radio frequency coil. The problem with the radio frequency coil that when you have metallic device in the electric field of radio frequency coil, it could be a heat. It can elevate the temperature and make heating and make burning of the spine, with causing irreversible neurological damage. And this is the reason why we need a MRI compatible system. Some years ago, Medtronic company and Boston Scientific company introduced a new kind of electrode with so-called Faraday sheath in the outside the electrode that can spread the temperature for the electrode and not make heating of the point of the contact, and not make damage to the spine or surrounding tissue. Another step, the evolution of IPG devices. There are 2 kinds of evolution: the evolution of the shape, of the size, and the evolution of the productivity. So the evolution of the shape and the size, you can see here. The first implantation devices were big, were not so nice, and the smallest device was introduced these years by Abbott company, the internal IPG. The volume of this IPG is less than 14 milliliters. Now, the changes were not only with the shape and the size, but also with the productivity of the IPGs. Some years ago, Medtronic company introduced to the market accelerometer-based technology, when the IPG can check the position of the body, vertical, horizontal, oblique, and make changes in the stimulation and make adaptation of the stimulation to the specific position of the body. It was not only the step in the treatment, but also the step in the investigation and research, because now we can document all body position and all body activity during different stimulation, and to show how it's useful and how it is helpful for our patients. The next wonderful and revolutionary step in the neuromodulation, in the neuromodulation devices was introduction of cellular product. This is absolutely a fantastic thing when the electrode sitting near the spine can not only stimulate the spine but also to check the electric activity in the spine fibers and make an adaptation of the stimulation to the level of electric activity on the spine, which is something absolutely revolutionary, absolutely fantastic that we can have and can implant to our patients. The next step was introducing a different IPG-free devices when we implant the electrode with the antenna but without the IPG. IPG is external. It is better for thin patients. For patients, we can eliminate pocket infections and pocket pain and different other problems. There are some companies producing such devices. Steamwave for now, Curonics company, Steam Router. So we put the electrode, they put the antenna on it, and we have transducer and stimulator, external stimulator that can make the treatment. So another way of evolution is the evolution of software, evolution of waveforms, protocols, and algorithms. The first waveform that was introduced to this kind of treatment was tonic stimulation, when we have, square-shaped waves making the stimulation. So there are some observational criteria of such waves and waveforms. Their amplitude. When we change the amplitude, we can change the stretch of the signal. When we change pulse width, we can change the area of stimulation. When we change frequency, we can change the character of the stimulation, and we can change different contacts, anode and cathode, and make changes of the stimulation. So the first idea here was to increase a pulse width and increase the frequency to make maximal coverage by the electricity. So it was named by high dose stimulation, and from the beginning it was shown very high effectiveness of such kind of stimulation for different pathologies. First of all, of failed back surgery syndrome. The next step was introducing machines that can make different frequencies from the acceptable standard frequencies such as 80, 40, 50, 60, 80 hertz up to 200, 500, 1 kilohertz, and even 10 kilohertz. It was a very interesting thing, absolutely paresthesia free stimulation. You just turn on, turn off. Patient doesn't feel the stimulation, he just feels that the pain is on or pain is off. That's all. So it was very interesting thing that was introduced, and the mechanism is not really we don't really understand the mechanism of this stimulation, but it was shown that such high frequency stimulation can decrease the wind up phenomenon and the central sensitization of the nerve system. On the other hand, we know now that different frequencies can activate different areas in the brain, and it's appeared then when we make combination of different frequencies, we can stimulate not only pain perception areas in the brain, but also pain memory areas in the brain, which is absolutely interesting. And it was shown not only in the biological researchers, but also in clinical researchers, and we see the much more effective stimulation than when we make a combination. This was the basis to introduction different algorithms to the market, such as Illumina, such as contour algorithm, fast algorithm, walking and activating different areas in the spine and different areas in the brain. Now we know that there are some algorithms such as DTM, different target multiplex algorithms that can make normalization of gene expression in the neurons and in the glial cells in the spine. So it can relatively cure and normalize processing and gene expression in the spine in patients with chronic pain. Another thing and another step in the development was introducing so-called burst stimulation, burst DM stimulation. The point is, and in nature, there are two kinds of electricity in the tissue, in nerve tissue. It is tonic stimulation and burst stimulation, which is much more stronger because of the temporal summation of the spikes. And it's appeared that when we make tonic stimulation, we can activate tonic stimulation and burst stimulation. We can activate different areas in the spine and in the brain. Tonic stimulation can activate the lateral pathway with activating of somatosensory cortex. Somatosensory cortex and somatosensory pathways. So when we make burst stimulation, we can activate so-called medial pathway and activate limbic system in the brain, activate the areas which are responsible for the emotional component of the pain. So now we can treat not only the pain itself, but also the suffering of our patients. So next important kind of evolution is evolution of targets of stimulation. We began with spinal cord stimulation, but now we know very well that the first station of pain propagation is dorsal root ganglion. It appears that we can stimulate dorsal root ganglion. We can put the electrode in the nerve foramina with the stimulation of dorsal root ganglion. It's appeared that the mechanism of such stimulation in pain treatment is absolutely different than spinal cord stimulation. Here, we can activate so-called T-junction cells, pseudo-unipolar cells in the dorsal root ganglion with blocking of pain propagation. It led us to put electrode even in peripheria to stimulate different peripheral nerves and make improvement in the pain in specific areas, include occipital nerves. This very important thing that we can stimulate occipital nerve with changes in the electricity in brainstem, with desensitization of so-called trigeminal vascular complex. It can let us treat not only local neuropathic pain, but also central headaches, primary headaches, such as migraine, trigeminal autonomic cephalalgias, and many others. Implantation of electrode to the sphenopalatine ganglion. Implantation of electrodes to the vagus, which are very important, very interesting thing that can decrease of excitatory stimulation in the brain and decrease different kinds of headaches. Implantation of the electrodes on the facet joints on the median branches, so that we can make the restoration of multifidial muscles and very good treatment and very good help in rehabilitation of our patients. So the last thing that I want to mention here is the evolution of clinical approaches and indications. So the deal began from the failed back surgery syndrome, and it make very long way with introducing different other indications such as peripheral neuropathy and any other neuropathic pain you want, postherpetic neuralgia, phantom limb pain, stump pain, low back pain in non-operated patients, peripheral ischemic pain, angina pectoris, and so on. But the most important and most impressive thing elevated last years was introducing the neuromodulation in rehabilitation. It is amazing thing then you can put electrode in spinal injured patients and to see him walks. This is absolutely fantastic, and this is the future. Thank you very much for your attention.
Present work mine and of Professor Paolo Bartolomeo Pascolo of University of Udine. The title is called Brain Immateriality. The philosophical hypothesis behind this work is that immaterial properties and physical properties are properties of the same object and they are linked together from the beginning. Behind what we thought, it is that the Cartesian thought of the dualism between immaterial soul, for example, material things, soul, for example, and material things. The current, the doubt, the Cartesian doubt is the doubt that is there something is really truth and out there, and we can doubt of everything, but not about the fact that we are doubting. This means that we can gain something certain, go on, because we can say that our perception maybe can be false, but we are always perceiving, in fact. And nowadays, the philosophical boundaries between what Cartesio thought as the distinction about res cogitans is indeed the perception, because is hard to think that we perceive is something transcendent and immaterial. The question is because why we not can we not introduce the whistle field in res cogitans, and why we cannot introduce what we see every day out there as something transcendent and immaterial, to make this idea confident and realistic. We have imagined that there are we talk to the all or nothing single cell activation in the nervous system that can vary between 0 and 1, and a link with the coordinates of the our visual fields, colors properties, as we see colors out there, the white of an object, and so on, and in three-dimensional axis, as in Cartesian axis. We combine the coordinates of the single cell activation in the nervous system with the coordinates in the paint of colors of the visual fields. The problem is now how to bind first and second Cartesian coordinates, cioè physical ones of the cells and immaterial transcendent ones, that of the visual field. If we think what happens to retina when they receive light signal, there are modifications that can be traced till the lateral genicular body and till in V1. What happens is the logical sum of properties of the visual field. From the point of view of the transcendent immaterial properties of the visual field, there is a logical sum of colors and so on, and while vary in brain elaboration what is computed, because from the material point of view there are biological and neurological coordinated, while in the transcendent immaterial field of our visual vision of colors, there is the logical sum of point of colors. for what we can think about the actual debate about what is consciousness and what is immaterial properties of our experience, we can think that consciousness, redness, a consciousness or redness, for example, are simple immaterial properties, and there is not to find. There is not to research, because what is there, what we talk about consciousness is simply a simple properties of an immaterial fact. The consciousness or redness is not something hard to comprehend, hard to understand, because it's simple and immaterial properties, and is a properties like redness of a chair, redness of a shirt, and redness as a property of properties of a perception or what experience. The philosophical thought behind this kind of way to see at what happens to brain elaboration for vision, for color vision, is the distinction that material and immaterial properties not as something separate, but as something that something that can go linked together from the beginning, simple as a fact. So as consciousness, that consciousness appears with the immaterial properties of a brain event in simple something that is a fact. There is not to explain. There is not to explain. Reason to accept property dualism are, for example, that we can, if what we see, if what our mind was something of material, there should be a lot of interference that we can de facto see. Is for what is the mechanism of vision from retinal to visual field V, no? To visual area V, no? Is hard to comprehend, as visual perception is something different, of something of transcendent and immaterial, because the mechanism of vision show us that the information enters by the retina by a light signal, and there no any direct contact with object out there. However, this is an idea to link immaterial properties of color vision and material ones, and then there is not problem if the things goes in a different manner. This is an hypothesis to the work of the representation of colors in our visual field. What is important to comprehend, to understand, is what is important to comprehend and to understand is that from the retinal elaboration to that of the genicular lateral body, we can see that cells ordered in the brain can have a correspondence with the visual field in an act of vision, as the coordinates of the 0, 1 activation of the cell can be represented in a three-axis system of the visual field. This representation leads us to think that there should be a strict correlation between cell activation from the modulate signal at the beginning of the retina to the construction, and the representation of colors can vary between intensity and so on, and frequencies from the retina with the specific roads till to the visual field V1, where not only colors but also other features like direction of boundaries of the objects and so on can be represented together as a logical sum of immaterial properties. The gain of double material and immaterial properties till instead only material one, and that without immaterial properties and as colors, we cannot we not see nothing at all, in a sense, and they are immaterial because if they would not, there were a big problem to say how some physical is so physically untouched. The philosophical background, we see the problem is that of dualism. The problem of dualism is that sometimes that also Husserl is faced, but I trace back to Cartesio, is one of the first that put it under the spotlight, is that Cartesio think to dualism, res cogitans and res extensa, immaterial properties and material properties as separate, but he think after that sometimes they could have linked, and as in the case of the brain, the soul and the res cogitans, and the res extensa, the soul and the body, etc. The point of the properties dualism and simple, there are objects that have material and immaterial properties. This is a way to say something that is not of contradictory in itself, and is a position that can simply go on. The translation of the neuroscience in material properties is a covariation, because what I put under the spotlight is that the importance of is in a sense the material properties more important, because they are the material properties that leads to an outlook, a point in our life, in our experience, while the brain work to realize that, in a sense, because the risk is that our life, entering in all aspects, is something that simply, as in in pop films, as the Matrix and so on, something that has not importance at all, while is probably because the sum of the logical sum of immaterial properties of our experience, our will, and so on, is the way to make the brain work. We have seen what can happen from the radiant to the brachiocerebral cortex, and now there are the references of our work. Our work as mine of Professor Paolo Bartolomeo Pascolo has a lot of novelty. I wrote some essay in Italian about the question of dualism, the question of perception, the question of our experience as humans from I think in some aspect new point of view, and I try to put under the spotlight a way to see, to experience different from what think thought till now. The problem of accept perception in the experience, in the human experience, is in philosophical sense, and also neuroscientific sense, very hard, because it's the door that a door that is difficult to open, because if we accept experience in visual perception and perceptual experience, in visual perception, in our perceptual experience, we have to say that what we live every day is a lot different from the object in itself, but is our experience that is formed in the world, but that we have no relation direct with the object, the external object put in the world independent from our minds and from our perception. from the other side, is easy to see how there is not direct contact to ears, to eyes of the objects, but indirect. And the sensa in itself are not only a door for the external simulation, but are a wall for external stimulation, because it receives external stimulation, but is a door for the object. The object can not enter in sense perception. Way we think to the touch, we can say maybe yeah, no, but for vision, for eyes, and for ears, and for smell too, the situation seems to be really easy to say. The object don't directly enter in our experience. The experience are mediated by sense. That the meaning is simple to understand, but what happens is not only not so simple to realize, that our experience is more and more strange respect to what we accept. Big philosopher that have thought something like that, we can say Kant, but the interpretation of Kant, the actual materialism, has put this kind of research in the shadow. This essay has this kind of novelty, and say that immaterial properties can go on and to be linked together is a way to go over the problem, to say from a logical point of view that res cogitans and res extensa are in a sense two distinct things, that because if are distinct, how they can go on together, why so only sometimes and not ever, why we have not to introduce other hypotheses. Is simply a state of things, is simply to underlie a fact. The study is a theoretical study, but we take in consideration the fundamental studies, a lot of studies that there is now someone in references that we are taken to think about perception of color. The study of Guras, Huber, Kaiser, Kandel, Lam, Lavazza, Robinson from the other end, talking about dualism and Searle, intentionality, and so on, and Davidson. There's a classic. Thank you for your attention.
And disabling chronic migraine secondary to inoperable cerebral arteriovenous malformation. So, brief idea about our case in the introduction. So she's a young female, healthy and active, presented with a headache with migraine characteristics. And then we found out that she has AVMs. She was under conservative management, and she's doing well right now. So, getting into the topic, arteriovenous malformation. So, what is it? It's a developmental anomaly of the vascular system characterized by arteriovenous shunting throughout the collection of tertiary vessels without an intervening capillary bed. So, what are the locations? What's the etiology? For the sites of the AVMs, the most common one and the most serious one is the brain AVM, and it could also be found in the spinal cord and the renal system and the lungs. So basically anywhere, even in the skin. But the most serious one and the common one is the brain because it could lead to hemorrhagic stroke or anything, and it's with serious complications. Okay, so AVM detection rate is 1.2 in every 100,000 person per year, and the incidence of hemorrhage is 0.2 in every 100,000. So here we can see the difference between the normal capillary beds between the arteries and the veins and with the AVM. So it's such a tortuous area, very tangled blood vessels, and we can note that it's very maybe edematous. We can see it, and it would be easily tortured and ruptured, leading to hemorrhage. So, what's the etiology? The exact cause remain unknown, but some research say that genetic factor may interfere with it. They believe that um, various organs can have the AVMs, as we mentioned, but certain hereditary conditions can increase the risk of AVM, just like Oster-Weber-Rando syndrome, where a patient or a person could have a very high pigmented area on his body, and while screening, they could find an AVM somewhere in the body, most commonly either in the brain or the renal system. So, how would a patient with AVM present to the clinic? They may come with hemorrhagic stroke, which is the most serious one. They will be having speech difficulty, arm weakness, inability to walk, and it will be incidental at that time. Epilepsy, they could be misdiagnosed and as epileptic patients because they have seizures, although the epilepsy is due to underlying cause, which is the brain AVM. They may have chronic headache, mainly migraine, and dizziness or confusion. Other patients would be very healthy, just presenting asymptomatic. So the finding will be incidental. So, what are the diagnostic investigations? The gold standard one is the angiography. While the MRI imaging is also very important, CT is also taken into consideration, but MRI and angiograph are the first line one. So the AVM grading, there is what's called Spitzler-Martin grading. It has three main components: the size of the AVM, small, medium, and large. Each one has its own points. The location, non-eloquent, eloquent. Eloquent, it's where it affects the medulla oblongata, it affects the pons, the midbrain. So it's an eloquent area. Patterns of venous drainage, is it superficial or deep? So it has mainly 5 categories. The less points, like grade 1, it's easy and could be easily operable, until we go to grade 5, which is a serious one that it's nearly inoperable or with high risk of mortality. If you'd excuse me just for 1 minute. And there is also a grade 6, which is the most serious one. It's beyond this grading, where the patient if she or he is going into a surgery, mortality rate exceeds 90%. So AVM in pregnancy. Cerebral AVM hemorrhage is rare, but it's very important complication and serious one in pregnancy. So with the 28% maternal mortality and 14% of fetus death rate, the risk of rebleeding in the same pregnancy cited from 27 to 30%, greater than rebleeding risk in non-gravitas population, 2 to 6%. So in such cases, if a pregnant lady came to the emergency, she's having any symptoms of bleeding or hemorrhagic stroke, so MRI could be done, but the more specific one is the CT scan, which could be done safely if a lead protection was put in on the abdomen of the patient. Migraine, the second aspect of our case. So migraine, it's migraine features
Dr.
was
Malak,
reported in yes
your
malformation, both as migraine with and without aura. Migraine with aura was reported up to 58% in women with the cerebral arteriovenous malformation. So how do you diagnose migraine? Without aura, it should fulfill 5 attacks within these criteria. Headache attack 4 to 72 hours. Headache has at least unilateral location, pulsation, moderate to severe pain, and aggravating with causing limiting to physical and daily activities. And during the headache, the patient could have nausea, vomiting, photophobia, and phonophobia. Migraine with aura is similar to the first one without aura, but it's before having the attack itself. For a few minutes, the patient will have some, most commonly visual or sensory or other central nervous system problems before developing the headache, which usually resolve in 5 minutes, and then the headache starts. So what's the treatment of migraine? Since the 1920s, the migraine was taken into consideration, and many classes and treatments were given. So in 1920s, ergotamine, 1960s to 70s, beta blockers and antidepressants, 1990s to 2000s, triptans and anti-epileptic. In 2010, which will be concentrating on the botox injection, and also botulinum toxin, known as botulinum toxin. It was approved in 2010 and it's used till now. In 2010 to 2020s, CGRP antibodies and blockers were used. So how do you inject? What's the dose? So internationally, it's 155 international units with intervals of 4 to 6 months, depending on the severity of the case, and in 31 sites. So here we can see how it's spreaded. So the frontalis for injections, procerus 1, corrugator 2, temporalis 8, occipitalis 6, cervical spinalis 4, and trapezius 6. So in our case, she's a 23-year-old female presented with episodes of severe headache for 5 months duration on the left side. It got more frequent in the past 3 months. Headache is throbbing in character associated with photophobia, phonophobia, and nausea without vomiting. Each episode lasts between 4 to 48 hours, 18 to 20 days of headache, typical migraine features. So she fulfills the criteria of migraine without aura. In such cases, we try to dig into the history. Why did the headache start? Is there any specific thing? We couldn't reach to any clue, but she started having mood changes. She's very depressed because of the headache. It's limiting her from doing and practicing her regular life. MRI was done, and it showed very great finding. So we can see here, MRI without contrast was done. It showed a large extensive arteriovenous malformation with high flow, identified at epicenter of the left cerebral hemisphere. We can note it here. Of the posterior fossa. The malformation appears to be fed mainly by the arteries originating from the posterior.
Sorry, but your presentation is frozen.
Circulation, the vertebral arteries, and the dilated meningeal arteries, which are from the carotid artery. The venous drainage was mostly into the vein of Galen and the straight venous sinus. There is a sizable aneurysm vein, which measures 2.3 centimeters on the axial plane in the left cerebellopontine angle. There are very severe compressive phenomena on the left aspect, on the medulla oblongata, on the left cerebral hemisphere, the left cerebral peduncle, the pons, and the midbrain. There is also narrowing of the fourth ventricle and dilation of the other ventricular system. There is also some dilation of the Meckel's cave, which are prominent on the left side. So she also, after that, went for second opinion. She didn't believe in this, just tried to deny it because it's such a serious case. Went to have some other opinions here in the UAE and abroad in the United States, Germany. CT angiograph was done, and the diagnosis was confirmed. Patient came back to the clinic. She was very depressed. Some doctors told her that she should be very aware that she's at a high risk of death and mortality. Then she came back. We counseled her and talked to her that living the worst part of your life, which is the childhood, hitting your head everywhere, and then you're still safe right now. So the risk is considerably low. But now we should treat the symptoms so you can feel better. For the treatment, we tried for 4 months.
Dr. Malik, your presentation is kind of half frozen.
However, it responded dramatically for the botox injection, as we mentioned, the 55 international unit, 31 sites, with interval of 4 to 6 months. So then 4 years later, she presented to our clinic. She was discussing with us the plan that she's planning for marriage, and there's a possibility of pregnancy. So how will we manage it in this case? Counseling with the patient, taking into consideration that she's healthy, she's doing well. MRI was done. There's no change, no bleeding, no recent hemorrhage or signs of hemorrhage or hemorrhagic stroke. So we agreed with her for the marriage. She got married 3 months into marriage. She became pregnant. She continued to follow up with the neurology and the obstetric and gynecology department. And during her pregnancy, in the 3rd trimester, she was posted for cesarean section. And it was done. She delivered without any complications, and her pregnancy was without any complication. A healthy baby girl was born. And she's doing well right now. Also, the patient is planning for another pregnancy right now. So for literature review, going into the literature about similar cases, we can see that most of the reports were about the bleeding and the hemorrhage that happens during pregnancy, but with minimal reporting of successful pregnancy without any complications with patients with AVM. We can appreciate that there is a risk of mortality and hemorrhage, but at the same time, reporting of safe cases would give the doctors courage and even the patient hope that they can proceed with normal life. At the same time, botox wasn't really an introduced modality of treatment of migraine secondary to AVM, which was done in this case. I think this is very important that a new modality of treatment should be reported and used so it could be effective, although it haven't been used before. So in a conclusion, in this case, so we have 3 main lessons. The first is large arteriovenous malformation while she presented just with headache migraine without aura. The second is botox injection, which wasn't really introduced before in patients with migraine secondary to AVM, and it did a dramatic effect with amazing outcome. And the third thing, that a big challenge and concept, that large inoperable AVM associated with the high risk of intracerebral hemorrhage during pregnancy, but delivered health, she's being healthy and the baby without any complications. And thank you.
Poland, in Warsaw. It's our main hospital for patients with neurological problems and psychiatric problems. And during the pandemic, we decided to check the sense of mental state of our colleagues, psychologists, during all waves of COVID-19 pandemic. And it was really tough time, as you know, for everyone, because whole societies needed psychologists, and everyone expected them to help in sudden life changes. Everyone probably know that changes during first days of pandemic in our countries. And in Poland, as in other countries, psychologists switch from personal to remote contacts in their work, and they had to combine professional duties with private life, and of course, growing number of psychological symptoms in patients, the old patients and the new patients. And in a lot of studies, a level of load was compared even to doctors treating. The stress of psychologists was similar. The aim of my studies was to show trends in changes in whole pandemic time. In Poland, we have context of burnout risk, because even before the pandemic, we had problems with burnout in that work group, in psychologist group. And we have 5 waves of pandemic, and we ask via online survey in the website of Polish Psychiatric Association. We ask our psychologists to tell about the subjective mental state and about changes in their everyday work life. And at the beginning, we received more than 100 responses. And in the end, as you can see, we have more than 60 answers from our psychologists, but we send an emails to the same group. And our local bioethical committee was informed about that study and agreed. And we decided to collect data in the period from 2 weeks after our government told us that the wave is started, and after 3 weeks after the peak of infections in Poland. And demographic questions in our survey included gender, age, place of residence, and potentially predisposing features to more severe course of COVID-19. And questions about our population reactions was connected with context of burnout risk factors. We used a statistics package we have in our institute, and questions assessing objective mental state have questions similar to standard psychiatric interview and clinical practice during stress moments in human's life. And the questions concerned in such things like subjective stress level, mood, energy level, both, anhedonia, and problems with sleeping. First wave, as you can see, as in whole our world, start in spring 2020, and in Poland, almost everything was closed from the beginning, and we even have bans on access to park, forest, and beaches. So it was really hard for people and very hard for their mental state. The second, autumn, half a year later, we have a regionalization of restriction, and we have red zones, yellow zones, green zones. And all the time we have to have face masks. The third wave, spring 2021, was really tough for us because we have in Poland vaccinations, but still not for everyone. Healthcare workers and really old people had access, but not everyone in Poland. The fourth wave, autumn 2022, Omicron variants appeared, as you know, in Poland also. And the fifth winter, spring 2022, we had a lot of dissemination of vaccines. And on March 28, our government decided not to obligate to wear masks for us. And here you can see the psychologist's reaction and working condition during the 5 waves. And as you can see, parameters, working mode, fear of deterioration and changes at work, changing the value system. So philosophical question about, we asked that if quarantine is right for me, what is the hardest during the quarantine? Fear of getting infected, fear of infected in my family, and subjective stress level. And here is typical subjective mental well-being questions for responders. And here you can see a stress level. And I just describe you our results. Our group showed a trend of increasing subjective stress, depressed mood, energy level, low energy level after the outbreak of COVID pandemic, up to the highest level in the third wave. Subsequently, the trend in these areas decreased after the third wave. It was very interesting for us. Stress and depressed mood of our responders still have a high level also in wave number 5. Deterioration on the various aspects of sleep has clear tendency to grow to third wave and go down after that wave. And subjective mental state of our psychologist group was deteriorating until the third wave as a group of very aspect of subjective mental state. But it's very worrying, still worrying, that during the 5th wave, they still have high percentages in the area of subjective stress in depressive mood. And that's why we decided to look in for prevention of burnout, because it's really necessary. And everything what our group experienced and high level of stress experience in the last wave may result, as everyone knows, may result in burnout. Especially in Poland, we have still such situation that a lot of teenagers still go to psychologists, psychiatrists, because they have a new mental problem, and parents have mental problem too. And a lot of these patients is problem with depression, anxiety, and some other problems connecting with online schools, online work, And still in Poland, we have such situation that a lot of people in huge companies still work in their flats, in their houses. And that's the huge problem because of lack of connection with other people, personal connection. And that's why they used to go to psychologists, to psychiatrists. And it's really tough because huge companies not decided to do some changes in that mode of working. And thank you for your attention. If you have any question, just ask me. Thank you.
Food disorders, depression, and intestinal microbiota by my client, Dr. Andres Ursa. It is a submission for the International Conference on Neuroscience and Psychiatry held in Dubai, United Arab Emirates, on the 16th and 17th of November 2023. This is Dr. Ursa's curriculum vitae. And this is the table of contents for this presentation. Introduction. In Hippocratic medicine, diet was taken into account as a preventive and curative measure for diseases. While it is true that there were not many therapeutic resources 2,500 years ago, diet was present in most therapeutic interventions of the time. The concept of diet in ancient Greek medicine is similar to the current concept of lifestyle. Since I began practicing medicine in 1984, I've always considered lifestyle as the most important preventive measure. As in Hippocratic medicine, proper nutrition plays an important role as a preventive and curative measure. In recent decades, the importance of the digestive apparatus system in a person's health has been strengthened with the discoveries made about the intestinal microbiota. Epidemiological data. Depression is a common mental disorder globally, affecting approximately 5% of the adult population. And here is the reference. According to the World Health Organization, it's the leading cause of global disability, referenced. This disability represents an increase in general morbidity and mortality. Etiopathogenesis of affective disorders. Depressive illness is influenced by genetic, hormonal, immunological, biochemical, and neurodegenerative factors. Diet modulates each factor and as a result has a plausible impact on the development and course of this disease. There is increasing scientific evidence on the relationship between diet and mental health. Scientific evidence suggests that inflammatory processes play an etiological role in the onset and maintenance of depressive disorders. Inflammation may in part account for the association between chronic non-communicable diseases, depression, and mortality, as well as associations with diet. Role of the microbiota gut-brain axis. The microbiota gut-brain axis, MGBA, consists of a bidirectional communication network that monitors and integrates intestinal functions and links them to the cognitive and emotional centers of the brain. This encompasses the central, autonomic, and enteric nervous systems, as well as the neuroendocrine, enteroendocrine, and neuroimmune systems. This axis mediates the effects of genetic and environmental factors on brain development and function, and has been implicated in the etiology of several psychiatric disorders. Communication pathways linking the gut microbiome with brain function. Factors that can alter the intestinal microbiome. The intestinal microbiome can be altered by the following external factors: diet, exposure to antimicrobials, and disruption of sleep patterns. What does nutritional psychiatry say? Nutritional psychiatry is a new field of research for the prevention and treatment of some mental disorders, focused on developing a scientifically rigorous evidence base around the role of diet and nutrition in mental health. The first studies to examine and establish a link between overall diet quality and common mental disorders, depression and anxiety, were not published until the last decade. Oxidative stress, brain plasticity, and the microbiome gut-brain axis are key targets for nutritional interventions. Possible nutritional approaches: psychobiotics, nutraceuticals, supplementation, recommended foods most studied, and diets, Mediterranean, plant-based, and vegan. Psychobiotics in depression. A psychobiotic is reported as a living organism that offers health benefits to people suffering from a psychiatric illness when consumed in appropriate proportions. Psychobiotics are a type of probiotic that affect the central nervous system functions and behaviors by means of immunological, humoral, neuronal, and metabolic pathways. They improve not only gastrointestinal function, but also antidepressant and anxiolytic capacity. They are mediated by the microbiota gut-brain axis. Psychobiotics and inflammation. The use of psychobiotics has encouraged researchers to focus on a new field of neuroscience as a unique class of probiotics. Some psychobiotic strains have been found to suppress inflammation and reduce cortisol levels, resulting in improved symptoms of anxiety and depression. The gut microbiota may play an essential role in brain activity and cognitive development by synthesizing hormones, immunological factors, and metabolites, according to data from animal and human research. Nutraceuticals, they act on anxiety and depression. Zinc, for neurotransmission. Magnesium increases serotonin production. Omega-3 series fatty acids, vitamin B complex, and vitamin D3. Zinc and depression, studies from recent decades. Magnesium and depression, daily supplementation with 248 milligrams of elemental magnesium as 4 500 milligram tablets of magnesium chloride a day leads to a significant decrease in depression and anxiety symptoms regardless of age, gender, baseline severity of depression, or use of antidepressant medications. While the crossover design of this trial is robust in controlling for internal bias, it would be reassuring to see the results replicated in larger clinical trials that test long-term efficacy and provide additional data on subgroups. However, this efficacy trial revealed that magnesium supplements may be a fast, safe, and easily accessible alternative or adjunct to starting or increasing the dose of antidepressant medications. Omega-3 fatty acids and depression. Omega-3 fatty acids may currently appear as an adjuvant agent for the treatment of depression. This recommendation is endorsed by several meta-analyses that involve a high level of evidence, which has led to their use being contemplated in expert clinical guidelines or recommendations. Some meta-analyses detected superiority of icosapentaenoic acid, EPO, over docosahexaenoic acid, DHA, and recommend a higher proportion of the former if omega-3 fatty acids are selected as adjuvant agents in antidepressant treatment. Vitamin B complex and depression. Low levels of vitamin B12 and other B vitamins, such as vitamin B6 and folic acid, may be related to depression. Further research is required for conclusive results. Vitamin D and depression. The presence of vitamin D receptors in the brain, which play an important role in neuroendocrine function, has been documented. A low serum vitamin D concentration can negatively impact the growth and communication between cells, as well as neuron activity. The vitamin has been linked to serotonin production, and there are some quotes on the next page. The reference for vitamin D and depression. Diet and mood. Dietary factors may modulate the risk of neurostructural and cognitive changes in the brain that affect psychological symptoms across the lifespan. Researchers from the University of Technology, Sydney in Australia have recently evaluated how diet and nutrition guidelines impact depression symptoms in young men aged 18 to 25. Results of the AMEN study Results obtained after 12 weeks of intervention revealed that compared to the control group, participants in the Mediterranean diet group observed a significant improvement in their depression symptoms and a higher score on the quality of life scale. Other studies on improvement of depression with diet. Diet and inflammation. Adherence to a Mediterranean diet rich in vegetables, fruits, legumes, whole grains, fish, olive oil, and low-fat dairy products correlates with lower levels of inflammatory markers. Western-type diets and diets high in refined carbohydrates are associated with high levels of C-reactive protein, which indicates low-grade inflammation. Other references on inflammatory diet and depression. Antioxidants and depression. Diet influences oxidative processes which may also be involved in the pathophysiology of depressive illnesses. Diets rich in antioxidants appear to be effective in delaying or preventing the pathophysiological and cognitive changes associated with age. Influence of diet on the production of brain-derived neurotrophic factor. Nutritional factors exert a direct and important influence on neural physiology. In experimental studies, a Western-style diet reduced levels of brain-derived neurotrophic factor, BDNF, in a short time, an effect that was independent of obesity or nutritional deficits. Role of BDNF in the central nervous system. BDNF protects neurons from oxidative stress and promotes neurogenesis. There is evidence that BDNF plays a central role in psychological depression. It is possible that by modulating the expression of BDNF, diet can influence psychological state. Depression and the Mediterranean diet. PREDI-DEP, Prevention with Depression Diet, Nutritional Intervention with Mediterranean Diet in the Prevention of Recurrence of Depression, to see whether a Mediterranean diet supplemented with extra virgin olive oil or walnuts can reduce the incidence or relapse of unipolar depression over 2 years of clinical follow-up. This could contribute to findings that the Mediterranean diet reduces the link between comorbidities and depressive symptoms in people with severe depression, as reported by an Italian research group in 2020. Mediterranean diet in the elderly and depression. Plant-based diet and prevention of depression. High-quality vegan and vegetarian diets are associated with a lower risk of depression. Recommended foods: vegetables rich in vitamin K, broccoli, kale, spinach. Whole grains have dietary fiber. Nuts, walnuts have omega-3. Fatty fish rich in omega-3 series fatty acids, salmon, sardines, trout. Fruit, anti-inflammatory and antioxidant, strawberries and blueberries. Anthocyanins, tea and coffee due to polyphenols, methylxanthines. Turmeric, curcumin has antioxidant and anti-inflammatory effects. Conclusions. A high-quality diet influences the pathogenesis of common chronic non-communicable diseases and includes highly prevalent mental illnesses, such as psychological depression. Confirmation of a causal relationship between diet and mental health would provide the possibility of an evidence-based preventive healthcare strategy that incorporates dietary improvement. This resource would help prevent these mental disorders. Intervention with dietary improvement should be a resource to implement under conditions such as chronic anxiety and depression. A whole vegetable-rich diet, whole plant-based food, helps improve our mood in several ways. On the one hand, it provides us with a large amount of antioxidants with anti-inflammatory action, and thanks to certain phytochemicals such as quercetin in onions, kale, green tea. Plant-based foods rich in tryptophan, a precursor to serotonin, could contribute to the treatment of depression. Eliminating foods rich in arachidonic acid, pro-inflammatory, such as most foods of animal origin, would help reduce inflammation. including plant-based foods rich in omega-3, flax seeds, chia, walnuts, seaweed, etc. in our diets can be beneficial. The possible positive effects derived from the omega-3 contained in fish are counteracted by the inflammatory state this causes due to its arachidonic acid content and neurotoxic heavy metals, mercury, etc. A fiber-rich diet helps maintain a healthy intestinal microbiota, avoiding intestinal permeability. And here are the references.
Hello, that was a wonderful presentation. Thank you so much.
In particolare con stimoli neurosensoriali.
This project is based on the factor of cognitive and social influence that our mind gets from the environment where we live. Next slide.
Sì, può passare avanti?
Can you give us the other slide, the next one, please?
Yes, please.
Ecco. Stimoli neurosensoriali che non solo facilitano la comunicazione non verbale, ma attivano una serie di circoli neurosensoriali e aree cerebrali. Andiamo avanti?
Un secondo. Those kind of stimuli inputs, they come from sound and also images that we can experience on daily basis. Those activate our emotion, but also our cognitive processes. Next slide.
Il lavoro di preparazione è stato un po' lungo, nel senso che abbiamo preparato una serie di immagini, foto con una modella, con un fotografo. Si sono preparate 6 colonne sonore di diverso genere musicale. Sono stati somministrati questi stimoli, prima solo quelli visivi, in sequenza. Successivamente questi stimoli sono stati associati ad una colonna sonora e con una distribuzione poi di un questionario di 14 items. I volontari erano 17, ripartiti in 3 categorie: studenti universitari, operatori sociali e anziani dell'Uniter.
Starting from this consideration, we decided to run this experiment called Matter 2021. We had a sequence of pictures of a model in different contexts that was doing daily life activities, and we also used 6 different music played by different musicians. The idea was to show just the pictures for 5 minutes, so without music. Then to show again the same pictures, the same sequence with different music, so for all kind of music for 20 minutes. And then we gave a questionnaire that had 14 items. We recruit 71 people with different ages. We had 14 students with an age between 19 and 25, 23 social workers with an age between 20 and 60, and then 33 elderly with an age between 61 and 85. Next slide.
Lo scopo di questo studio era quello di osservare se c'era un fattore di influenza e di cambiamento sociale solo sulle immagini, o se le immagini associate alla musica avevano un fattore prevalente. Il secondo obiettivo era verificare se questo cambiamento di stile nella comprensione emotiva o cognitiva era lo stesso per le diverse età cronologiche.
We had two main goals. The first one was to see if the images, with or without the music, were able to affect the emotional and the cognitive process. The second goal was to see if these kind of changes were the same across all the three different groups. Next slide, please.
In questo grafico si evidenzia chiaramente la divergenza di costruzione della storia dell'immagine visiva. Infatti il gruppo Uniter risponde totalmente, quasi totalmente, con immediatezza nella costruzione della storia, mentre gli universitari e gli operatori rispondono con un 50%, 56,50% con l'immediatezza.
So the first question we asked was, looking at the pictures without music, can you get any sort of story? We can see from this plot that 94% of the elderly answered yes, so they were able to get a meaning from these pictures. Meanwhile, for the social worker and the students, that was true only for 56% and 50% respectively. Next slide, please.
Cambia totalmente il secondo grafico. Nel secondo grafico dove vi è l'associazione dell'immagine con le colonne sonore, rispondono sempre in maniera totalizzante il gruppo dell'Uniter e in questo caso i gruppi universitari e operatori vengono coinvolti in maniera più massiccia in quanto c'è questa associazione dei due processi della visione e dell'ascolto hanno una maggiore significato.
Then we ask, looking at the same pictures, but with the music on the background, were you able to get any meaning? Were you able to get a story out of these pictures? And we can see that the students and social worker now answer differently. With the music, 81% of the students and 65% of the social workers were able to get a story out of the pictures. That's what, from this we can see that the combination, the association of sound and visual, they combine together and they're able in our mind to be processed together to get a story. Next slide, please.
I tre gruppi risultano comunque concordi nel dare una colonna sonora che dà risalto all'immagine, che dà anche significato a quell'immagine, che la cambia totalmente e soprattutto modifica lo stato d'animo della foto.
Okay, all the three groups agreed on the fact that the meaning of the pictures changed if the music changes. There is one kind of music that emphasizes the sequence of the images. There is one kind of music that changes the meaning of the images. There is one kind of music that is also able to change the emotion while we look at the pictures. And they still prefer the images over the music. Next slide, please.
In questo grafico si osserva come vi è una maggiore distribuzione su tutto il grafico delle risposte dell'Uniter per quanto riguarda l'adeguatezza della colonna sonora sulle immagini, mentre risulta esserci un picco di preferenza dei due gruppi gruppi di operatori e universitari nell'ambito della colonna sonora Vescio.
Then we asked if there was one music that was more adequate for the images. On the x-axis, you can see the different kind of music. The name that you'll see on the x-axis is actually the name of the musician. What we can see from this plot is the students and social workers agreed that the most accurate music was played by Vescio, while from the elderly group we don't see a peak on their preference, but they are kind of spread across the 6 different musics. Next slide, please.
Per quanto riguarda la colonna sonora meno adeguata, risulta essere sempre questa distribuzione equa, diciamo, su tutto omogenea da parte dell'Uniter in tutto il grafico, e coinvolge comunque un altro picco di non adeguatezza della colonna sonora sia nel gruppo universitario che operatori, che rispondono in maniera omogenea, prestando una maggiore concentrazione su questa colonna sonora renda.
Then we asked if there was a music that was less adequate, and we can see something that is very similar to before. Social workers and students agree that that there is one kind of music that is less adequate, which was the one played by Renda. While for the elder people, there is still not one unique choice, but the choices are spread across the 6 different musics. Next slide, please.
Concludendo, possiamo dare già una prima risposta al primo obiettivo posto, quello se la sola immagine poteva dare un cambiamento, una storia significativa, oppure se associata alla colonna sonora.
Okay, so answering the first goal was whether the images with or without music can change our mood, or the meaning of these pictures changes according to the music. And we can see from the next slide, please.
Quindi si osserva che da sola l'immagine ha una rappresentazione immediata, un accesso immediato alla realtà. In questo caso l'immagine quindi crea un processo dinamico che evoca e rispecchia le emozioni in maniera molto chiara, ma comunque vi è nel gruppo degli universitari e degli operatori, non tutti danno trovano questa immediatezza, e quindi trovano un ancoraggio ai dati percettivi e frammentari della foto.
Okay, we can conclude that the images by themselves are able to give a story in general, even if we have to remember that there is a big portion of people, specifically 50% of the group of students and 50% of the group of the social workers, that were unable to get a story just from the pictures. Next slide.
Mentre i 3 gruppi rispondono in maniera compatta nell'associazione tra immagine e sequenza sonora. In questo caso questa associazione crea un cambiamento cognitivo ed emotivo, proprio con una sincronizzazione nella percezione, provocando una ricalibrazione cerebrale nel dare significato alla storia.
While when they looked at the pictures with the music, then almost all the people, regardless their age, were able to get a story. That's because in our mind there is a process that associates images and music and sound, and that makes able to recalibrate the meaning of what we are listening and what we are seeing. Next slide, please.
In questo caso, nella metà dei giovani e degli operatori si effettua una sintonizzazione emotiva, empatica, che supera quella rigidità e quella frammentazione nella visione. Si integrano tutti quegli aspetti che inizialmente erano ancorati soltanto nell'ambito dell'aspetto estetico.
So the relationship between these two different inputs are able to give also to the younger people of the group of the volunteers are able to give a meaning to what they are seeing, what they are listening, and what they were unable to perceive before just by looking at the pictures then became available to their mind. Their mind was able to process once we put also the music. Next slide.
In questi casi, in questo caso, ecco, oltre alla elaborazione dei circuiti neuronali del visivo e quello dell'ascolto, questi due circuiti neuronali si sincronizzano ricalibrando nuovamente in un aspetto percettivo congiunto dell'immagine della musica, cioè si ha una ricalibrazione del senso temporale a livello di sincronizzazione del cervello.
That's because we have some neurons and their circuit that became active once they perceive different inputs, and they are quickly able to recalibrate all the inputs that they are getting to make the whole picture in just one whole picture and give a meaning to all the inputs, summarize them, process them, and get the meaning of what is happening. Next slide.
Il secondo obiettivo, la risposta al secondo obiettivo, se c'è questo cambiamento emotivo e cognitivo, se avviene nei tre gruppi in maniera omogenea.
The second question was if there is a change in terms of emotion and in the cognitive process, is this change the same across all the ages? And from this study, we can answer that. Next slide, please.
This one. I tre gruppi esprimono con più frequenza le emozioni di tristezza, malinconia e speranza.
All the three groups that express emotions such that sadness, melancholia, and hope. Next slide.
Il gruppo Uniter si distingue perché esprime uno spettro di emozioni più ampio, con degli stati d'animo più equilibrati, empatici, compassionevoli, esprimono cioè più un vissuto esperienziale, partecipato a livello emotivo, con una consonanza affettiva e cognitiva altamente significativa.
However, the elderly had also emotion that involved sympathy, being compassionate, and everything that is related to having more experience. That's probably because their brain is more mature, they had more experience during their life, and that's why also the emotions that they feel are different compared to the youngest groups. Next slide.
Il gruppo invece operatori sociali e universitari esprimono una gamma più estesa di definizioni delle emozioni, soprattutto sono sollecitati dall'aspetto tecnico-estetico della foto, oppure utilizzano sostantivi che definiscono l'atto cognitivo del momento oppure lo stato affettivo del momento. oppure sono legate a disposizioni interiori del soggetto.
On the other hand, students and social workers had emotions that were related more to what they were seeing, so to the beauty of the model, looking for the beauty, to charm, or to be feelings like being more introvert or difficult to decide to what was the story, and also feelings like being curious or like mystery and freedom. Next slide.
Grazie per l'attenzione. Sono a disposizione per le domande.
Thank you very much for your attention. I'm happy to take any question if any.
About the conflict between artificial intelligence and translation. Recently, there has been an increased practical interest in artificial intelligence and even an attempt to absolutize the capabilities of AI at the highest scientific level. To begin with, what translation as one type of human activity has to do with current philosophical problems, including transhumanism? Without delving into the origins of the emergence of transhumanist ideas in the modern sense, one should turn to the teaching of Ludwig Feuerbach with his thesis that man created God in his own image and likeness. Feuerbach clearly traces the ideas of collective consciousness and the conclusion that the human community can never achieve perfection and happiness provided that it contains individuals. Kai-Fu Lee, a well-known Chinese scientist in the field of modern technologies, emphasizes that one can be optimistic in the development of artificial intelligence only by remembering the responsibility in this area. As an example of the technocratic direction of transhumanism, he cites the ideas of Ray Kurzweil, the inventor and major ideologist of Google, who believes that in the future people and machine will merge together. According to his idea, people will constantly renew body tissues with the help of nanorobots introduced into the bloodstream. Kurzweil predicts that by 2029 we will have computers with human-like intelligence, and the singularity point will be reached by 2045. Singularity as a term means the superiority of machine intelligence over the capabilities of the person who created it. We should not forget about the susceptibility of the major to professional deformation, intellectual limitation to the sphere of their own activity, which gives vastness for the promotion of the ideas of the singularity. However, in any case, with all the cybernetics improvements of an intellectual creature, with the inclusion of a trunked biostructure, mainly brain structure, its modifiers, the technocratic elite, pursue the main goal, the management of intellectual energy within the strict framework of technology while maintaining the subordinating hierarchy within the framework of AI. The goal is old as the world. The focus is on the question of power. The inability to perceive reality in a multidimensional way inevitably turns into the indifference of technocrats, and such indifference is a demonstration of the absence of humanitarian instruments of difference. In the first place, in the project with strategic priorities developed by COST, European Cooperation in Science and Technology, Languages and Interpretation. And not by accident, translation, for all its antiquity and for all its significance in most areas of human activity, still continues to remain terra incognita in many of its aspects. Translation, like an X-ray, reveals secrets hidden under the clothing of words. Our research object. The research object are focused on the study of main trends in translation development in the digital area, influenced by the impact of AI and technologies. My analysis of modern publications on total algorithmization, my own scientific and practical experience in the field of translation, allows us to demonstrate the discrepancies between technological forecast and the real facts of the unpredictability of innovative systems. About methodology. The conclusions about the mechanism of translations are made on the basis of a comparison of the initial and resulting data. It was used two basic methods. Number one, comparative analysis in revising the content of translation. Number two, introspection in defining the translator intuition as a form of consciousness in representing the author's subjectivity, reality among their manner and style. Discussion. A very important idea is that translation begins much earlier than interlingual translation itself. When an attempt is made to recreate the text of one language within the framework of another, that is, an attempt to transfer it from one language space to the bizarre structures of another one. If we approach the problem of translation more broadly, then, in principle, translation is a universal property of human thinking. Before putting a thought into a speech form, a process takes place in the mind, the sequence of which, in our opinion, is as follows. Amorphous thought form, next is thought idea, next is thought text, and the last one is translation, transmission into the source language for communicative exchange. The success of a translation largely depends on how the author's worldview is combined with the translation worldview. The text is not a complete closed result, but a connection to other text, to the sphere of what stands behind the text and is associated with the associativity of human thinking. According to Georgian researchers Vardilashvili and Pevna, even a single keyword of lingua culture, basic concept, can be read as a text that generates hypertextual connections. The transfer of the volume of an idea depends on the translator's understanding of its meaning and his ability to identify markers, which are the key to opening the doors to the extratextual, subtext, intertext, extratext, and so on, associative space. Schematically, the explicit sequence of the translation process is a double logical semantic chain. The external level and the internal psychological level. These two sides of the process are combined in the inter and extra action of compiling a commentary, the result of which is the selection and reproduction of an adequate idialect key sign. The possibilities of AI in the field of technical natural science, narrow professional translation are indisputable. However, translation, based on the creative imagination of the translator, is fundamentally different from all other types of translation, which require the utmost accuracy of wording, the absence of ambiguity of both vocabulary and the text as a whole. A clear sign of artistry, according to Surtsev, of the text and the text of its translation is, first of all, the absence of one-dimensional meaning. Based on this, the figurative associated component is a marking of the artistry of the original text and its translation. We are talking about the specific of the normative approach to artistry. As a result of analytical work based on a comparative and introspective research method, I present the following main aspects of the functioning of AI in the field of translation in comparison with natural authoring and translation activities. As you see from the table, stages and conditions of creation of the original text and in translation, author begins the translation process in the following context. Number one, a biological and social personality, of a holistic perception of the world, native language and culture, one's own object, the emergence of a volumetric idea. What about translator? He or she begins the translation process in the following conditions. Number one, a biological and social personality. 2, a holistic perception of the world. 3, native and foreign language and culture. 4, perception of a foreign object. And the final was a primary understanding of the meaning. What about AI, machine? It executes the translation process in the conditions of, number one, absence of biological and social personality. 2, subject of market production. The difference is also visible at the introspective process. Author has hidden creative, individualized materialization of his own imaginary object. What about translator? He has hidden creative, individualized materialization of someone else's real object. What about AI, machine? It has lack of creative process and works with programmer's real algorithm. The difference is also visible at the level of results. The author's result is original, artistically and spiritually complete linear text. The result of translation process is dual variable result, primary, translator's creativity, secondary, dependence on the author. Next, an attempt to create a second material nature of the original in the target language, and the text is linear. What about AI machine? The result is lack of artistic and spiritual integrity of the original and advantage processing speed. When modern machines are inferior to humans, AI functions better than humans in a stable environment with static, well-defined rules and consistent input. However, humans are much better than AI at handling surprises, filling in gaps, and operating in the environment with vaguely defined rules and lack of information. Yes, a computer can win a chess match, but not a polysemantic text with a little thing of human life put in a dead end. Can there be a conflict situation between a computer user and the so-called artificial intelligence, that is, the computer itself in modern ordinary conditions? From my point of view as a translator, I can answer in an affirmative way, yes. I will give you some simple examples of the conflict between the intervention of an automatic editor in the process of individualized speech. Here you can see some examples. When translating a word from everyday speech, I see a șușoti in Romanian language, that is to whisper in secret. I use the colloquial word șușucața with the same meaning in Russian. My choice was underlined in red as incorrect. I found a neutral word, șeptать, to whisper, and the red color disappeared. Second example, having sent a text message to a colleague, I turned to him with a playful distortion in his name, Sashoka, accepted between us. It was immediately replaced by the editor with the generally accepted Sasha. I dialed it again in my own way, the reaction was the same. And yet I achieved my goal, but partially. My choice was underlined in red. Can this be called a meaningful mental reaction of the machine? Of course not. A machine is a slave of a program laid down by a person, a programmer. The programmer in turn may consciously or unconsciously, to the best of his intellect, introduce his own preferences. The program of the machine is an imitation of the movement of thought, created by one person to perform, facilitate, or replace the activities of another person in a various field of activity. That is, with his algorithm, the programmer determines the sequence of movements, but not the thoughts itself. Instantly mixing ideas, genres, heterogeneous and unsystematic information from two or more areas and meaningfully connect them together and thereby solve an unexpected problem. Only a person is capable of this. Kevin Roos, in his book Resilient to the Future, quotes Maria Popova, author of the blog Brain Pickings, who calls this ability combinatorial creativity. For a literal translation, which, like any other creative activity of a person, largely reflects the intellectual and mental activity of a person in general, the use of AI is quite applicable for preliminary line-by-line text processing for two purposes. Number one, speeding up the translation process, and as a stimulus for creative work. In the table, you can see about internal process of creating and translating a literary text. It was demonstrated the difference in the functioning of human and artificial intelligence machine on the psychological side. As you see from the table, which is quite self-explicative, you see that the difference between author, translator and AI the following. Author has to deal with his own imaginary object, while translator deal with foreign real object. What about AI? It has lack of imagination. If we talk about imaging associative components, we can note they are in general the same, but the only difference is, as you can see from the table, is that the translator has combinatorial thinking. What about AI? It has lack of all imaging associative components. As we can see from the table, AI does not cope with the task of translating a work of art of both natural participants in the translation process. All elements of creative physical manifestations are an integral part of the mental activity of the translator or artistic literature. I emphasize artistic, linked with imagination. Machine translation as a product of scientific and technical research is very far from literary creativity, which is the process of literal translation based on the translator's creative imagination. It should be noted that not every translator can perform literal translation. This requires both personal, intellectual, creative, and psychological capabilities, as well as professional training. For example, the poem Luceafărul by great Romanian poet Eminescu has been translated into most of the world's major languages, but few come close to the original. The recent translation into Russian surprised by the abundance of literalism. So the translator did not go far from the unambiguity of the machine and attributed to one of the characters the beauty of a flower and a high position in society, making a literal translation of the folklore expression a young man from flowers, Romanian băiat din flori și de pripas, which in Romanian means bastard of low origin. The very interpretation of the concept of intelligence, which is linked with consciousness, a unique property of highly organized matter, is limited by the majority of technocrats to the pragmatic aspect. A huge role in this, as we have already mentioned, is played by the social factor. Stereotypes of thinking narrow the horizons of consciousness, imposing automatic algorithms, and suppress individual thinking. Speaking of translation activity, in our examples, following the algorithm of the programs leads to linguistic unification. And if we go further, to the automatic erasure of individual features of thinking, and even further to the deformation of consciousness. The machine does not think, it controls. Machines do not have a holistic model of the world, an idea of how people interact with it. Most intelligent circuits are designed to perform a single task, and AI cannot cope with the slightest deviation from it. And a curious picture emerges. When urgently translating your own text into another language with the help of a computer, quite consciously, as we noted in the introspective observation of our own translation process, we strive to adapt to the machine's algorithm. That is, we deliberately go towards the car in order to make our work easier. It is easier to take control of individual mental activity than to create the perfect IT. This is how the education of the user as an appendage to the machine takes place. Okay, now let's get down to conclusions. The main conclusions are the following. Translation is a universal property of human thinking, and cognitive processes are generated by the activity of the brain, and not exclusively by its structure. Next, reflection, the subject's appeal to himself, is one of the most important acts of consciousness, which makes it possible for an individual translation of thoughts into their native or any other languages. All elements of creative physical manifestations are an integral part of the mental activity of the translator of artistic literature, I emphasize artistic, linked with imagination. Technical approaches and algorithms of thinking process as an applied part of unpredictable volumetric thinking tends to rationalize, systemize, and regulate. The same is true with the scientific and technical areas of the language, which do not tolerate synonymy, polysemy, and variability. The whole complex of recognition and decoding of human communication abilities is inaccessible to a machine, which is AI. Next, the machine does not have the integrity of all picture of the world. The difference between the mental operation of artificial intelligence and human activity in the process of literal translation is a decisive moment in understanding the impossibility of conveying the volumetric aspect of an idea through technological sources, because with all the desire, a machine cannot fully include the naturalness and unpredictability of human consciousness. AI is a technology tool that has a dual role depending on the purpose of the algorithm developer, namely service and manipulation. And this refers to the psychological aspects of the formation of intellectual conformist thinking, including culture, education, information technology, business, and so on. This is my opinion. And what is your? To be continued. If you have any questions, I will be very glad to answer them. You can address me by email or phone number. Thank you.